Meeting to order, and the Nebraska Open Meetings Act is posted in the back of the room. Could you please roll call the members here, Angela?
Barb Beyer,
Here.
Michael Bowers,
Here.
Kathy Danick,
Here.
Miriam Gayler,
Here.
Srivastu,
He's not here yet, and you did a perfect job of pronouncing his name, so good job.
Cody Weber.
Here.
You have a quorum.
Thank you. So you all should have received a copy of the minutes. I would request a motion for approval, please.
So move.
Is there
Second.
a second by Brody Weber, motion by Barb Beyer? Is there any discussion? Seeing none, would you please call the roll?
Barb,
Yes.
Yes.
Kathy,
Yes.
Miriam,
Yes.
Brody.
Yes.
Thank you. Now is the time on the agenda for public comment for items not listed on the agenda. The Safe and Successful Kids Interlocal welcomes comments from fellow citizens. At this time, we are taking public comment on any item not listed on the agenda. The opportunity to comment on agenda items will be at a later point in the meetings. Is there anyone wishing to address the Interlocal Board? Seeing none, we'll move on to the next item, which is the election of officers for 2023-2024. Per the Safe and Successful Kids Interlocal Board Rules of Governance, the secretary to the Interlocal Board will be the Lincoln Parks and Recreation Director or designee, and the treasurer will be the City Finance Director. Parks and Recreation Director Maggie Stuckey Ross has designated Angela Quinn as the secretary of the SSKIB Board. Thank you, Angie. And the Finance Director, Lynn Heaton, will serve as the treasurer. Thanks, Lynn. The rules of governance also provide that the chairperson and vice chairperson will be elected by the Interlocal Board. And I will now call for nominations for chairperson. Brody.
I would like to nominate my colleague and partner in representing North Lincoln, Councilman James Michael Bowers, to serve as chair.
Are there any other nominations? Are there any other nominations? Are there any other nominations? I see no other nominations. Nominations are closed. Angela, do we do these one at a time?
I'm sorry?
Do we vote on these one at a time?
Yes.
Thank you. Then could we please have a vote on James Michael Bauer taking over the chairperson? I don't have the rules of governance in my hands. So.
Nomination made by Weber. Barb,
Yes.
Yes.
Kathy,
Yes.
Miriam,
Yes.
Yes.
James, I can't go run nominations for myself, so would you?
Oh, I'm
please?
going to do.
Hmm?
I'll nominate you.
Well, I know, but
So
are you
James
sure?
presides.
I'm just going to hand it over to James, and he can run the nominations.
All
now.
right. Well, thank you so much. Next up, we will take nominations for a vice chairperson. Are there any nominations for a vice chairperson? School board member Beyer. Are there any other nominations?
No, I'm going to go and nominate.
Oh, that's what I meant.
Not myself.
That's what I, sorry, yeah. To nominate
Kathy Danick.
Kathy Danick.
My colleague on the school board.
Nominate
Thank you.
Kathy Danick on for vice chair of the Interlocal. Any other nominations? Do we need a second for the nominations?
No, you just do it.
No? Okay, cool. Seeing any other nominations? Any other nominations? Any other nominations? Seeing no nominations, we'll wrap it up. And we'll close them up. And can we do a vote to make school board member Kathy Danick the vice chair?
nomination by Beyer for Kathy Danick as vice chair. Barb,
Yes.
Yes.
Kathy,
Yes.
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 All right. Next, we'll move up to a review of annual report on mental health services. Just to reiterate, the three primary areas funded with the interlocal board dollars are proactive services with the CLCs, protective services with school resource officers and our threat assessment officers, and preventative services with behavioral and mental health services. Today's presentation relates to the last category of preventative services with behavioral and mental health services. And I would like to introduce the LPS Director of Student Services, Ryan Zimbabwe, to introduce your team and present the annual report on mental health services for the 2022-2023 school year.
Thank you for the opportunity, and I'd like to say, as a former principal, middle school and high school principals, these three components, CLCs, the SROs, and the mental health supports have been a tremendous asset to the schools that I've served in and continue to see that in the role that I'm in now, so thank you very much. I am going to introduce our team of experts. They're the experts here today. So I have Allison Hedrick, who is our safety social worker. We have a new position. Christy Lang is also a safety social worker. And then Andrea Phillips is our social work coordinator, who oversees all the 43 social workers we have in our school district. So I'm going to turn it over to Allison.
Hello, my name is Allison Hedrick. I am a social worker on the safety and security team. And I describe it in that way because the threat assessment piece is one area that we serve related to keeping kids and families safe in our community. So for the first review, our threat assessment team consists of a security coordinator who is John Sundemeyer. He's a certified threat manager. And then there's the two social workers, me, and then Christy Lang. She's our newest member on our team and has added the capacity to monitor things over time. Then we have our Lincoln Police Department partner, Officer Nate Hill, who's our investigator. And then we have a contracted behavioral health therapist, Carrie Nider. So the primary function of the threat assessment team is to assess and manage targeted violence to prevent mass violence in our schools. Targeted violence is predatory or planned violence, and so although our focus is very narrow in looking for that needle in a haystack to prevent mass attack, our work goes beyond that in order to come from an orientation of creating safety and prevent what we call before the bang situation. And so we act very preventatively, and our primary orientation is towards helping, and you'll see that as I describe things further. And so how we work with families is that a concern is identified and we partner with schools as a subject matter expert to provide consultation and support related to safety planning and resource management. We help align school supports with what behaviors of concern are being identified, and then we assess for the level of risk. We act with our community partner with the Lincoln Police Department only in times where there would be an investigation of a criminal behavior, and our goal is not engagement in the criminal justice system. We value professional development and train as a team so that way we can maintain best standards of practice that are consistent across the nation. Like I said previously, the majority of our referrals come from school buildings, and administrators are our primary point of contacts. However, we provide open access to anyone in our school system who wants to contact us related to a safety concern. We maintain documentation of those situations, and our primary areas of focus are violence, risk concerns. However, we are also contacted related to mental health crisis situations that are needs some intense level of management and planning. And then also our third area is this combination of various risk safety concerns that may exist in the school environment. We average about 120 cases of working our full threat process a year. So over time, it's important that we're monitoring those cases, thus the need to add another social worker to help in that work. We've now been functioning for 5 years as a core centralized threat assessment team, and we want to provide that continuity of care over time to ensure that through mobility and transitions to different schools, if a student needs a support plan, that we're helping to provide that continuity between those transitions. The other way that we are informed of concerns is through our Safe to Say app that's on our homepage and also communicated in family messaging and on our student Chromebooks. This is a function to increase our reporting from students and community members to also identify safety concerns and to build our culture of reporting, because threat assessment is only as good as the information that we know, so that way we can act. This, safe to say, allows for anonymous reporting as well. So to try to eliminate the barriers someone might have to reporting a safety concern, we allow that and communicate that out to our students and our families. My primary role in the team is I'm a social worker, and so I contribute to assessment through gathering of psychosocial information, which would be looking at school records and providing my input related to the mental health situation that might be occurring in that situation, and provide recommendations for how to manage those concerns using resources and coming from it from a helping standpoint that people will do well when they have what they need to do well. And that's where we really operate to help people get on a new path. So I coordinate a lot of safety planning and mental health resources, and then we're the conduit to the contracted behavioral health therapists that we have on our team as well. The therapist on our team is another element that Interlocal provides support for, and it's important that we have a contracted therapist on our team that's focused on only serving kids that are identified through safety concerns, so that way we can eliminate all barriers to access to services if mental health resources will reduce the risk of concern. And so we include her in our training processes and our weekly meetings in order to not only get her behavioral health expertise at the table, but also so that way we can monitor the kids that she's seeing for therapy and their violence risk over time. She also provides additional services to help fill some of the gaps in our school system. For example, she provides short-term solution-focused therapy in our expelled student program to help identify safety strategies that will prevent them from engaging in the behavior that led to their expulsion. That's the threat assessment aspect of it, and I'm going to introduce Andrea Phillips, who will talk about the other parts of the mental health resources associated with the Interlocal.
Hello, I'm Andrea Phillips, and I am coordinator for school social workers in Lincoln Public Schools. We have 43 social workers who are all licensed mental health practitioners, but I also have the honor of working with these 4 community agencies to help coordinate therapy. So we work with Family Service, Hope Spoke, Blue Valley. And we really, Allison did a good job of highlighting students that come to our attention through safety concerns, but we also have some additional services that these therapists provide for students. And we really try to have those students move through our multi-tiered systems of support in school. So that just means we have lots of kids that are in need of therapy, but we really have to kind of look at what services have they already accessed in those lower tiers. So that's something that we try to do with school-based therapy, is really look at what lower tiered supports have they tried to access, and if those haven't been successful, then therapy might be a good option for them. So the therapists are located in the schools, and social workers use data through the tiered systems of support to help decide what referrals would be appropriate. So these are the candidates for school-based therapy. The things that we're looking at: mental health symptoms, life stressors, disruption in multiple areas of their life. Lower level interventions have been tried. The biggest thing that helps kind of single some of these out is that they have barriers to participation with outpatient therapy. So they have a need for outpatient therapy, but due to transportation or finances or parents' work schedule, they're not able to access those therapy services. So those are really kind of our first priority to get into therapy. Looking at the 3 different agencies that we work with, Blue Valley Behavioral Health provides YAP therapy, which is Youth Assistance Program, and that is more of a short-term solution-focused program. So When they're seeing a therapist through YAP, they typically see them for about 6 to 8 weeks, and then they are referred on if they need additional support outside of that. So there's 18 schools that are served through YAP, 192 students, 6 to 10 sessions. And then the other side that they provide is threat assessment, which Allison talked about, and some support in our student support program. And through that funnel, they see 19 students. Last year, 24 students were served through YAP, and 41 students served through SAMI. And SAMI is our substance abuse evaluation, and all of those provide evaluations, short-term interventions, and ongoing therapy. Our second agency is Family Service, and they provide therapy at Arnold, Brownell, Calvert, Norwood Park, Randolph, and West Lincoln. They served 82 students last year, 1,300 direct hours and 657 indirect hours. They keep very specific records. They did 43 family sessions, and they reported having 75% of their students with successful closure rate. Hope Spoke is our third agency. They provide therapy at Lux, Goodrich, Pershing, and Lakeview. They served 33 youth last year. 31 of those youth also had case management. So that means in addition to therapy sessions, they also were working with parents on access to community resources and things like that. 575 total sessions for Hope Spoke, and 85.7 demonstrated improved daily living, which is the outcome measure that they use at Hope Spoke. So this just gives you an idea of the numbers that have been served over the years. So you can see 2021 was our highest, but we are right in line with last year with the previous year, 391 students served. I will say, I will talk about this in an upcoming slide, but this is mostly due to lack of providers in our community. Agencies are struggling to hire licensed mental health practitioners, and so there are some vacant positions that they're still trying to fill. But you can see that Blue Valley last year saw 216 through YAP, 19 through threat assessment and student support, Family Service 82, Hope Spoke 33, with a total of 391 students served. So we gather this information just by doing a satisfaction survey each year. So you can see that 80% of students reported being satisfied with their therapy service, 76% comfortable talking with their therapist, 98% believe their therapists treat them with respect, and 88% of students agree or someone agree that therapy helps them handle their daily lives. 83% of school staff believe they have a moderately high level of collaboration with a school-based therapist. 64% of school staff believe that they can access school-based therapy in a timely manner. And 78% of school staff believe they receive a moderate to high level of feedback from the school therapist. I will say that the 64%, I think, accurately reflects what I'm talking about with some positions that are vacant. And so in those situations, they do have difficulty accessing them because some of those positions have not been filled. So see, these are just some quotes that we got from families. I won't read them to you, but you can see that we got a lot of positive feedback from families. I will say, from talking to families myself, families are overwhelmingly thankful when they're able to access therapy through their school day. There's lots of reasons why it's challenging outside of school, and with the inability to access a lot of outpatient outside of school, this is a huge, huge benefit to families, and they are very, very thankful. So last two things we wanted to mention is just some of the ongoing challenges, which I've already mentioned some of, but therapist retention and recruitment. So like I said, with the 3 agencies, we do have some vacant positions that have not been filled. They're working very hard to come up with strategies to hire, but it is an overall community barrier. Agency funding sources, just going forward, making sure that they can continue to sustain the services, and access to outside community services. Again, that usually goes back to funding and just making sure that families are able to access. One thing that's really hard right now in our community is affordable housing. So working with families, we have a lot of families that are homeless, and trying to help them access those services is challenging. And then the last thing is just sustainability. So obviously we want these supports. They've grown a lot over the years, and schools have really become dependent on them. Families have really become dependent on them. And so as different funding sources shift, we want to be able to sustain these things. And lastly, looking at just the broader vision of, our hopes for the future, improving integration between therapy and school support. So we always want to work to make sure that they feel like they're an active part of our team, and that we are really looking at other supports that are available in the school as well. Improve student outcomes. Academic and behavioral is obviously one of our goals, and something that therapy is helpful with. And the last thing is just we always want to align to our board equity goals of trauma-informed practices and restorative practices. So that is something that we are always striving towards. I think that's it.
So with that, we'll entertain any questions you might have.
Are there any questions? Board Member Byer?
Yeah, I totaled up 28 schools that you serve, right? So do you see a need beyond those 28 schools?
Yes, and we do offer therapy services to all 60 schools in our district.
Okay.
This is very specific to the interlocal. So in all, I think we have over 952 hours of therapy per week in LPS, covering all schools in LPS.
That's great.
Yeah.
And is there a need to increase this support?
Without question.
Yes, there are waiting lists for some of our therapy supports, and like I said, there are some schools that have vacant positions with agencies. So the difficulty is, even with the funding, we have to be able to find the people. But definitely, we always could use more, and we do have waiting lists.
And you do have waiting
And when we
lists.
talk about that shifting in funding, we use a lot of ESSER dollars for therapy services. So we're working to look at grants potentially moving forward so that we don't have that cliff and lose that support for our families.
I have to say that this is really important to me. I think that it's the best way, particularly with children, to be approaching the issues that we find that can create violence in our schools. I believe that acting out violently, often, particularly with children and adolescents, is really a cry for help. And that if we're able to identify that they need mental health supports and services, that we're all better off, particularly the child. So I understand your challenges. We hear about these challenges at our board meetings, Kathy and I, all the time, and Piyush, that the behavioral issues are big on the list of concerns for our teachers and others, and our kids are under a lot of stress these days. So thank you for your work. This is a great report. Thank you.
Board Member Danik?
Thank you, Chairman Bauer. So one of my questions is, what do we have for strategies in place, I need probably Van here, to find social workers and therapists if we can't find them in the community? We have a grow your own student teacher to teacher. What do we have in place for this?
So for school social workers, we're only short one social worker, and we have been doing interviews. So I wouldn't say we're to the crisis point yet with that. And LPS doesn't provide the hiring support for these agencies necessarily. They're independent agencies. But I know from talking to the agencies that some of them have started doing hiring bonuses. They've worked to increase their salaries, provide more support. When the therapists are working in school buildings, I know they've worked to kind of shorten their schedules to make it more of an incentive, because they are primarily working with students, so they may not work over the summer. So those are some of the things I've heard from agencies that they're doing to try to recruit.
So one of the things I've been doing is working with the universities and their master's programs and speaking to students in honors programs who are looking at these careers in the future. And they keep telling me that the numbers are down. And in some way, shape, or form, maybe this is something we need to look at, even for focus programs or with the Career Academy or something, of targeting kids to master's programs that would help them. I know when I spoke to the honors program a week ago, there were a lot of future teachers, future therapists, future social workers in that room of 60 people, and it was pretty impressive. And so there are avenues going out there. I don't know how many kids are going into it. They don't view it as a fun job, but then I'm not sure kids really view going to work 40 hours a week as, quote, a fun job. So that's just some thought processes. Is there any work being done from your side of the therapists associations? I don't know if they have an association. Do they have associations? Do they have groups that funnel names and prospective client? Or
Are you
prospective-
speaking more specifically to like the agency-based therapists?
Or
They
do I need
do.
to call Katie McLeese Stevenson and get her to help me?
So for school social workers, we work with Wesleyan and UNO, who are two programs that have master social work programs. We have practicum students every year, and to be honest, almost 100% of the time they end up becoming school social workers. So that's a really good connection for us with those two schools. As far as agency-based, we have like NASW and SWAN organizations for social workers. Therapists have many different, they might be a family therapist, they could be a social worker. There's so many different ways that you can be a mental health therapist. So there's lots of different agencies that support, but that's good. I could definitely share that with the agencies that we partner with.
Thank you, I appreciate that.
Any other questions from the board? Board Member Payush?
I'm wondering if we have an idea of what the needs are in the community and what our resources is to see what the gap is, like how many more kids might be needing these services, and you already told us how many we are providing.
Community needs assessment regarding mental health services. I'm not aware of, are you aware?
The health department has done something with that. Jesse Davey has done some data collection around that. And then also Lancaster Connected is a group that I'm a part of that is also gathering that information. And then they have subgroups that have started with like transportation, food insecurity, different things like that. So those two groups are the ones that I'm aware of that have a pretty good idea of what those numbers look like and what the gaps are. It's tied to a legislative bill from last year that we're working towards opening some new things.
But what the barriers are to getting therapists and maintaining therapists, I don't know if that's a part of the community needs assessment. So like assessing the workforce on what is needed to sustain therapists in difficult jobs.
And I think what we're seeing the most with that is people that are graduating with their master's degree and going to private practice, whereas they used to work more for agencies, but now that people can work from home and that's a lot more of an incentive, that has taken away from some of our agencies.
Thank you.
Mayor Illyrian?
Thank you, Chairperson Bowers. Your presentation early on touched a little bit on the threat assessment piece of the work of the Interlocal, and I was hoping I could just ask a little bit about that. I think you mentioned there are 120 threat evaluations done annually or in the past year. Are those just specific to referrals that then move into this behavioral health program? Really my question is about capacity and what the district's needs are relative to threat assessment and the support that LPD provides.
Yep. So we have one LPD officer assigned to our team who's also assigned to assess community threat. He spends significant amount of time, at least on the LPD's side, with LPS. But I'll let them speak to their capacity, but on average, we serve like 120 full threat assessment cases, which means our full multidisciplinary team is engaged in that process. And if we've been doing that for 5 years, I mean, that's 600 cases over with one LPD officer and one, now we have 2 social workers. So we are busy. And the work in threat assessment involves ongoing monitoring, because you're only seeing a moment in time, and risk factors change over time, either positive or negative. And so reassessment is essential as part of the process. And so if we don't have that reassessment process or the capacity to do that, then your risk assessments are not as good. And so I will let LPD speak to their resources in that. But at the same time, I can say that they're busy too. And they do a lot of work to engage in home visits, to help with means restriction, to assess related to continuity with other officers related to other issues that may be influencing the safety concern. And reliably, LPD is at the table every week meeting with us as a multidisciplinary team.
Any other questions, Mayor? Board Member Danik?
So when we established this interlocal board several years ago, this was exactly the hope, and it's moved into fruition of a great project, because we felt if we could get the kids before they decided to do something off the spectrum, that it would keep them out of the system of the criminal justice system. We increased the SROs so that they're doing that community building work in our schools and addressing things that are against the law, but leaving discipline totally to the schools. We've drawn some great lines and some great paths. So I just want to say thank you for this report, because this is in place. It's not work done, but it's a step in the right direction. And we are a model for the country. I get calls as a board member, or when I go to a CUBE conference, of how did you put this in place? And it says, painstaking work, a lot of months of efforts, a couple of years of work, and people really dedicated to doing the work. So I wanted to say thank you to all who do the work.
Any other questions from the board before I kind of jump in? Okay, so this has been like my bread and butter for, a number of years. Like, I worked in the schools through Child Guidance Center, which is now Hope Spoke as a therapist, and I've been a school social worker for a number of years. And the three social workers that are here today are some of the best social workers that I think we have in the city. Social workers, we can be kind of have high expectations for each other, and these three social workers here are three social workers that I trust and ask for advice for often. So really, really glad to have you in those positions. One question I have a couple of questions. When the wait list, how long are the wait lists now for Hope Spoken for family services? And does it vary by school? And again, not taking it as gospel and knowing that it goes between, different schools. Would you say that in the middle of the year that the wait lists are more like a week long, or more like 6 weeks long, or longer?
So speaking to just...
Feel free not to answer too.
Just the therapy that we provide in the schools, it does vary by school. I will say that I've heard from our partners this year that this is the fastest that we've ever filled caseloads, which is a good and a bad thing, because it doesn't leave capacity necessarily. That's why we do YAP, though, because it's short term and we can get kids in and out. So I don't have specific numbers on waiting lists, but I do know that our social workers are licensed mental health practitioners, so they're working with those students as well to look at community options if it does look like the waiting list is going to be a while. So sometimes they refer them out for outpatient therapy in the community as well.
For sure. And because I know that one of the headaches, and again, like the family services and Hope Spoke, like those aren't run through LPS, right? So you can't control like what their policies are and how they operate and, essentially how they do things. But Hope Spoke sees folks that have Medicaid and insurance. Family service does not, if that's still the model as what it was a year ago, right? Family service, that's more grant-based. Does the Interlocal, since the Hope Spoke is funded through the insurance programs that they bill families, does the Interlocal then only fund the family services portion of that between those two, or does family services have outside grant dollars that are not part of the Interlocal? And maybe Lynn Heaton might know that, or the treasurer.
So it's really confusing because we have multiple, like Project Prevent is through, we have multiple different things within the agency, so I don't know that I can speak specifically to that. Do you know?
Well, all the agencies get outside funding outside of what the Interlocal is helping to provide for their services. The benefit of the Interlocal is that if they don't have Medicaid and there's a barrier to treatment, then they can, with financial, then it can be provided. But our other agencies, like Family Service does their own like fundraising and grant applications, and Hope Spoke does Medicaid funding, and that way in Blue Valley does private insurance and Medicaid outside to fund their agency's sustainability.
For sure. And I think that's like important to note that, again, for the Hope Spoke model, and I'm not entirely sure about the Family Services grant model, that they're making their money based on the services that they provide for students. So like when we look at the 83% of school staff believe they have moderately high levels of collaboration, the school therapists aren't getting paid for that. And in fact, that can cut into their productivity numbers because they're spending that time working with teachers, working with the social workers, and working with the counselors, and not meeting a productivity number, which could essentially affect their pay and the money that they bring in. So I think it's a true testament to the outside therapists that are working as a true team, even though they're not receiving reimbursement from that. Similar to that, when we say like school staff believe like the numbers, is that social workers only, or is that with teachers, principals, and social? You know what I mean?
The satisfaction survey?
Yeah.
Yeah, that goes to a wider group, so it's not just social workers. It's any adults in the building that are interacting with those therapists.
Cool, because I don't know if you all feel the same way, so because I'm only speaking for myself, I wonder if the numbers for, because as social workers, we work most intensely with these, outside therapists, right? I would be interested to know what the folks that are working intensely in trying to coordinate these services and trying to work through these wait lists, what our level of satisfaction is in that level of collaboration, right? Because our level of I don't work at LPS anymore, but the social worker's level of collaboration may be different than a teacher who maybe needs to speak with the therapist once a quarter or whatever. Has Family Services or Hope Spoke ever talked about removing their therapist from a school because of a lack of numbers or a lack of people receiving those services?
Yes, so I work with all of our agency leaders, and we make decisions mid-year, definitely at the beginning of the year, to shift people around. We keep track of referrals, and if there are places where they're not filling up, we do shift. So it's not a lot of schools that don't use. I think we had maybe 2 schools from last year that were a little bit low, and it might be because they had other providers in the building that were meeting the need. And so we shifted those. So there's not a lot, but we do keep really close eye on those numbers and make sure we don't have therapists sitting without referrals.
For sure. And, I'm not going to ask you to respond to this because I don't want to put anyone on the spot, but I wonder sometimes if, the inflexibility of like the insurance systems and the funding systems, if that's what's leading to a struggling amount of students getting connected to services, right? Like the diagnostic interview that has to be done by an LIMHP when not all the therapists provide or have that credential of an LI to be able to do the diagnostic interview. And I know that the LPS social workers, even if they have an LI, can't do the diagnostic because that's more of a patient-client thing. So, just to kind of say for the record or to throw out there, or just kind of get the voice heard, is I'm always concerned when agencies move around therapists because of the perceived lack of need, when really is that challenge or that barrier not being there at the right days, or not being able to get the paperwork turned in from the families, or not even being aware, because we don't know what people's insurance is until we ask them, right? So that's one thing I just kind of wanted to throw out there for the record. And one other statement that I just want to make, and then I'll stop talking, then I'll open it up to the public, is I'm surprised and I'm glad that there's only one opening left for a social worker. But, to be clear, for the general public that's watching, that doesn't mean that every school has a social worker that's dedicated to their building 4 days or 5 days a week. We have social workers that are splitting their time between multiple schools, and that really creates an issue when it comes into crisis at different schools. Social workers figure it out. We always figure it out, but in my dream world, every school has at least one social worker 5 days a week. Anything else that you want to throw out there for the good of the cause that you think would be good to note or put on there? Any of the 3 of you? Because if I was coming to a meeting like this and I wasn't elected, I'd probably be calling the 3 of you anyways to say, what should I put on there? Because you're experts in your field.
I just think we're really grateful for the support and for the partnership with these agencies because, like I said, they're very well received, and both buildings and families are very, very thankful for the support. So we're just happy to be able to help facilitate it.
And I would also just like to note again that the leadership that Lincoln offers in this interlocal across the country and our model in LPS of a centralized threat assessment team, we are often asked to consult with other districts across the country to set up their own teams. And how do we make the funding work is always a question. And then also, how do we do the work? And I think we've been able to provide that example across the country. And I think that says a lot about the dedication that not only this board, but the Lincoln community has related to keeping kids safe at school.
Absolutely. And you guys are doing, social work is not just case management, right? School counselors are not providing the mental health services. And I don't think the general public understands the full scope of what social workers are doing. And I think that this breaks it down really well. So I'm going to steal this information as I share it with folks. Last thing, do you know who Andrea's mom is? No. Barb Gazer, Executive Director of the Northeast
I
Union.
did not
Yeah.
know that.
That's
You've
how we
grown up since I last saw you.
Kathy and I were on that board at the same time, so sorry to throw your personal business out there, but I was up there. Okay, we'll move over to members of the public. Are there any comments or presentations at this time specific to the annual report on mental health services agenda from folks that would like to speak from the public? Anyone that would like to speak from the public? Anyone that would like to speak from the public? Seeing none, okay, we'll go ahead and move on. All right, we're going to move on to approval of the meeting schedule.
You need a motion.
Let me read this first real quick, and then I'll ask for a motion. Just to note, the meeting packet included in the interlocal board meeting schedule for the upcoming fiscal and school year. Meetings are proposed for the following dates and times. Thursday, November 2nd at 6:30 in the City Council chambers, where we're at now, when the annual SRO report, along with the LPS school perception and disciplinary data, will be reviewed. Then also Thursday, February 22nd, 2024 at 12:15 in the City Council chambers, when we will hear from Ms. Derby Bennett about CLCs and also discuss whether any changes to the current levels of services are recommended. And we will kick off the 24-25 year with our first meeting on Thursday, September 26th in the LPS boardroom. We'll elect officers then and also hear from Ryan Zabawa and his team again regarding mental health services. Please note that we will try to hold meetings to 1 hour or less, but meetings may run longer depending on the content. I would ask for a motion and a second approving the proposed meeting schedule. Board Member Danik,
I would move approval.
Second.
seconded by Council Member Weber. Are there any discussion?
This is just a suggestion that on the agenda, which is not exactly what we're voting on here or looking at, could you go and list when the public can speak on the agenda items?
Sure.
So that the public, if they saw this agenda, would realize they get to go and speak to the agenda item? Because if I were to look at, I go, oh, I don't get to talk on that today. So that's just my suggestion.
No, I think that's a good suggestion. Do you mind putting that in there?
Yeah, I'm not sure after each item.
Well, it says the basic focus of this meeting was the annual report on mental health services. So right after that, yeah, public comment on agenda item. It's just so the public knows they get to talk.
We've had a motion. Any other discussion on that? We've had a motion. We had a second. Before we do the approval, I'll just see if there's anyone from the public that would like to speak on this. Anyone from the public that would like to speak on this? Anyone from the public that would like to speak on this? No? Okay, so in seeing no discussion, seeing no one from the public, I would please ask for a roll call vote.
Barb?
Yes.
Yes.
Kathy?
Yes.
Mary?
Yes.
Yes.
Brody?
Yes.
Okay, we're going to move on to adjournment. Just to note, the next meeting is scheduled for November 2nd at 6:30 here in the City Council chambers. Focus of that meeting will be reviewing the annual report for the SRO program and the review of the LPS school perception and discipline data. May I please get a motion to adjourn? Motion by Member Byer,
I so move.
seconded by Board Member Danik. Any discussion? Seeing none, may we please do a roll call to adjourn?
Yes.
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 All right, see you all in November.